criteria for surgical site infection. Okay, so surgical site infection could be superficial incisional surgical site infection, then deep incisional surgical site infection, and the organ or space surgical site infection. Okay, so organ or space surgical site infection is similar to deep incisional surgical site infection. Okay, so we will see this both superficial and deep one. Okay, so deep incisional site surgical site infection, so infection occur within 30 days after the operation. So this is important MCQ, within the 1 month. Okay, and infection involve the skin and subcutaneous tissue, that is why it is called superficial, and at least one of the following. Okay, so pus should be present, so purulent drainage with or without laboratory confirmation from the superficial incision. So in simple word, pus should be there. Okay, and the second point, the organism isolated from the aseptically obtained culture fluid or tissue from the superficial incision. So simple word, pus culture comes positive. Okay, and the third one is diagnosis of the superficial incision made by surgeon or attending physician. Just remember, it is not only surgeon, even the physician, attending physician can make the diagnosis of superficial surgical site infection. Okay, and any of the following of the sign and symptom of infection, as you read in pathology, like pain, swelling, redness, temperature, all these are signs of inflammation or infection. And incision is deliberately opened by surgeon, and unless incision is culture negative. So incision is culture negative, it's positive, then no use of doing all this, it's already positive. So unless incision is culture negative, important. Okay, then deep incisional surgical site infection. Okay, so the same thing, infection occur within 30 days after operation. Okay, if the implant is there, so it should be within 1 year. Okay, so implant is 1 year. Okay, 1 year. Okay, and infection involve deep tissue like fascia and muscle, and at least one of the following, same, pus should be there, and the pus, and then deep incision is spontaneously dehiscence or deliberately opened by the surgeon. Okay, and then the signs and symptom of the at least fever, localized pain, tenderness, unless incision is culture negative, same. Okay, and there should be abscess. Okay, if there is pus there and it is not treated, it will lead to abscess formation. Okay, so abscess is seen either on direct examination, reoperation, histopathology, or radiological examination. Okay, and then diagnosis of the deep incision, say, made by the surgeon or attending physician, same thing. Okay, so this is important. The important one is if implant for 1 year, and other thing is operation within 1 month. Okay, thank you.